Great
Yes.
here. We are looking forward to her presence in November. So is Professor Guda. I'm very keenly looking forward.
Thank you very much for the invitation. I am pretty sure I'm looking forward to it a little bit more than you are. Thank you very much.
My pleasure.
Hello, Dr. Surya. Thank you for the invitation also.
Thank you. I'm looking forward, sir.
So last time Tina was in Mumbai, so you can now visit the capital, Delhi.
She came for Intropicon?
Yeah, she came from Intop.
I did.
Yeah, I remember.
She's a very active member of the tropical neurology group and so many things.
Just quickly, what is the order of the presentations?
Yeah, order of this, I will make introductory remarks, and then Dr. Nirmal Surya, President, will say a few words of welcome. Then Riyadh will speak about brain health and cognitive, and then you would like to speak something, or you would like to take part?
Well, I did prepare something because I had assumed that I was going to speak on something with memory loss for the general public.
Yeah.
I think I'm aware of Dr. Guda's presentation. Mine is very broad. It's about the general idea of memory loss. If I can go first, that would probably make better sense in the order.
Okay, fine.
Thank you.
So you talk first, then Riyadh will talk.
Mine will be brief.
Huh?
I will be brief.
Yeah, okay, fine. And around Atanu will try to finish by around 7:45. Professor WFN President, Professor Wolfgang Risol will join at 7:45 for a closing, because he has a meeting at 8 o'clock, another meeting. So I requested him to join at 8 o'clock when we had, but then he said he has another meeting which cannot be postponed or preponed. So he will join at 7:45. So we'll try to wind up by that time.
Yes, okay. Definitely.
Yeah. Yeah, Amitav, good evening.
Yeah, good evening.
Yeah, Fahim, good evening.
Good evening. Hi, sir.
So we are live on YouTube, we are live on Facebook, and we are live on Zoom. So all audience is, distributed at different places. So in another 2 minutes, we'll start, I think.
Resham, I think we should start because we have to finish it early.
Okay, we'll start. Dear friends, good evening. I am Dr. Chandrasekhar Meshram, Co-opted Trustee of World Federation of Neurology and Chief Coordinator of Public Education Activities of Indian Academy of Neurology. So I welcome you all on behalf of WFN and IAN for this last session of the week on loss of memory in the series during World Brain Week. I welcome President of IAN, Dr. Nirmal Surya, and I have a great pleasure in welcoming my friend, Professor Riyad Gudair. Riyad is from Tunisia. He has a mastery in neurology, clinical neurology, as well as in human genetics. He has a lot of interest in neuropathy, and he's a founding member of African Academy of Neurology. He was a president of Pan-Arab Union of Neurological Societies and has been very active in the World Federation of Neurology. So he has served as for 2 terms as trustee of World Federation, and now he's a co-opted trustee, and he's chair of teaching course committee of World Congress of Neurology in Montreal next year. So welcome, Riyad. I also would like to welcome Dr. Agustina, who is practicing neurologist at Accra, Ghana. She has interest in geriatric neurology, cognitive and behavior neurology, in addition to clinical neurology. And she's the president of African Academy of Neurology. She's regional director, Pan-African, Pan-Arab region for WFN. She's active member of Tropical and Geographical Neurology Specialty Group, WFN Membership Committee, WFN Group for Migrants, Neuroepidemiology Group. So she's very active in the WFN. The IAN has been doing a lot of public education activities. On 30th January, we did the session on neglected tropical diseases. 9th February, International Epilepsy Day. 24 March, World TB Day. 26 March, Purple Day. 2nd April, World Autism Awareness Day. 11th April, World Parkinson's Day. 30th May, Multiple Sclerosis Day. 5th June, World Environment Day. And for this World Brain Day, we planned more than 100 activities throughout a week. And doing the activities for a week is, has been our pattern, because the neurological problems are very important. And in the December month, we have been doing the National Brain Week for 7 days. So we had a wonderful week. I would also like to welcome for this session, the moderator of the session, Dr. Atanu Vishwas, who is professor and of Department of Neurology at Bangalore Institute of Medical Sciences, Kolkata, and Dr. Amitabh Ghosh, he is senior consultant neurologist and director of neurology at Apollo Green Eagles Hospital, Kolkata. Dr. Fahim Ahmed, assistant professor, Nimans, Bangalore. Dr. Meera Chandra, she is psychiatrist, professor and head of psychiatry, RML Hospital, New Delhi. Dr. Sujata Das, she is clinical psychologist, Arun Tagore Hospital, Kolkata, and Mrs. Vidya Shenoy, Secretary General of ARDSI, Mumbai. So once again, I extend a warm welcome, and I request President of Indian Academy of Neurology, under whose dynamic leadership we could do so many activities throughout the country, to say a few words. Dr. Nirmal Surya.
Namaskar, good evening. If you are in India, and wherever you are, good morning, good afternoon. It is indeed a pleasure. We are coming to end of the week. Today is the last day of World Brain Week. When we started the program we were really not sure how well it will go, but I must say that there's been a fantastic response from all the members of IAN across the country. And we are fortunate to have many experts from all over the world to take participation. As you could see today, we have from Tunisia and Africa. Similarly, we had every day somebody joining us and participating in the awareness program which we have created in India. The most important thing is we will also have today the closing remark and the week's total commitment by the neurologist from country, and that will be at 7:45, which will be chaired by the Professor Wolfgang, the president of World Federation of Neurology. I think the last topic is the most important topic today, the memory. And everybody is concerned, whether it is a child or an adult or a senior person or the elderly person. You all are worried about memory, and to listen from all these experts would be a real treat for all of you. So please keep on logging into the various channels of IAN. And if you have any question, direct them to these experts so that you can get the answer from them. I look forward to all of you active participation. Thank you, Dr. Meshram, for taking this to far and making this an active organization. Thank you.
Thank you, Dr. Nirmal Surya. Now I request Dr. Augustina. The theme for today's is, loss of memory, dementia, and she has an expertise in cognitive neurology. So, Augustina, for your address.
Thank you. Can you see my screen?
Yes.
Yeah, we can see your screen.
Thank you very much. I am humbled and very grateful for the invitation by the Indian Academy of Neurology, and I have to commend the extraordinary effort that you have all put in to make this commemoration of World Brain Day a truly super one. So not to waste any time, I do agree fully with the previous speaker. It's absolutely true. We're all concerned about our memories, and sadly, we think about our brain health usually when we notice that something is not right with our memory. And often by that time, it is already too late. So I will give you a very brief overview. Professor Guda, who will be speaking after me, will be more in-depth over what we consider to be loss of memory, what we mean when we talk about loss of memory, what can be done to avoid said loss, and improve it if it is already being lost. So we use our brains to learn, and the process of learning starts from infancy. And in order for us to learn, we have to build memories about facts, about events, things to avoid, things not to avoid, and the protection of our future memory. And memory is only one of the aspects of our cognitive functions. And when we talk about cognitive functions, we mean everything the brain does that is not simplified to movement or sensation. It is our ability to interact with our environment in a meaningful way. And memory plays a huge role in that. So all of us and our brain health, I'm sure it's been said many times in the past week, the health of the mother plays a huge role in the development of the growing fetus, the baby in the mother's womb, critical times in brain development, which will create the foundation for our ability to form memories and sustain these memories. There are so many critical times: the first trimester, birth, infancy, childhood, adolescence, adulthood. So in essence, every time of our lives is a critical time in brain development. So in general, when we talk about cognitive impairment or memory impairment or other brain functions, we talk about a spectrum of changes. So as we all get older, our bodies, our different organs, and the brain also undergoes certain involutionary changes. And by involutionary, we mean changes that are inherent to the process of aging. So this range from successful aging, where we don't notice any problems in our function, age-related cognitive decline, when we notice, oh, it's taking us a little bit longer to remember certain things. Most common one, where did I put my house keys? Did I turn off the gas before I left the kitchen this morning? Things like that. And then it can get more prominent than that, and we call that state mild cognitive impairment, where there is a more noticeable decline in our ability to function. And this, when we complain to our doctors, or our doctors notice that something is not quite right, when testing is done, and testing must be done, abnormalities are found on the testing, but not enough to disturb the person's general function. Then we reach, if it continues to progress, we reach a stage where we start talking about dementia, and that is significant changes in cognitive abilities, and this disrupts activities of daily living. So the things we generally take for granted when we're in full health: having a bath, getting yourself a meal, making calculations when you are buying something, things like that. So in essence, where we all want to be is right here. All of us, well, especially here, slightly less here, but this is good too. We want to be in a state where no matter our age, there is no significant change in our abilities to function. Or if there is slight change, it's only in the speed with which we function, but generally we're able to have sensible conversations, not forget the tasks and the skills that we have learned over our lifetime. Now, how do we do this? We want to be here, but it's not enough just to want. You need to put an investment into that brain health so that we stay at successful aging or any changes that are absolutely normal for age. So to clarify a few things, because there comes some confusion when we talk about age-related memory decline. And this is especially important when the general public, what is normal? What do we consider normal? And it's important to be able to tell the difference, because it makes a huge impact knowing when to seek medical attention, because this is not normal, or this is abnormal, I have to seek medical attention. Sometimes it happens, you go see the doctor and you feel you have a problem, and the doctor dismisses it, says it, oh, you don't have an infection, you don't have this, you don't have that, you're fine, you're just old. You know your body better than anybody else, you know how you function better than anybody else. It sometimes requires that extra effort to say, okay, no, I do believe that this is not quite normal. So as we mentioned earlier, memory does decline with age, and age-related memory decline corresponds with structural changes that happen within the brain, specifically the hippocampus. Older individuals are able to remember more complex items and relationships, and this does not change. What changes is the speed with which these memories are recalled. In general, though, if you start to notice a change in your speed of memory, or you're starting to feel like you're becoming forgetful, this doesn't yet mean that there is a problem. This doesn't yet mean that you have developed dementia, but it is worth looking into, because these tend to sometimes, rarely, not very often, but they do sometimes act as the gateway, the beginning of more significant problems developing further into mild cognitive impairment, and then when they are worse, into dementia. So we said we all want to be in the state of successful aging. When do we have to start work? Today is too late. Although today is better than tomorrow. So in order to age successfully, you have to do all the right things as early as possible. So again, back to the mother and her unborn child, making sure the mother is healthy, the pregnancy is healthy. physical activity for all ages, children, adolescents, young adults, older adults, the elderly, intellectual activity and education. There is nothing that stimulates the brain as much as education does. So again, it's educating our children, it's staying educated as we get older. Things are always changing, there are always new things happening. We should always strive to keep abreast of the changes that are happening. Very important and often overlooked is social and emotional activity, interacting with each other like we are doing today. I have to say physical interaction is a lot healthier for the brain than this virtual interaction, but this is also interaction and does still stimulate the brain. Our diets are extraordinarily important in maintaining brain health. A balanced diet. So sometimes people think that there's a kind of food that can cure all. Food is food, but it still does not remove at all the importance of maintaining a healthy, balanced diet throughout the lifespan. If your diet is currently unhealthy, change it. Now is a little late if you're an adult already, but it's not too late. It's never too late. There are certain things that are slightly harder for an individual to control, and that's our environment. But again, working with our societies, working with our communities, we can ensure that the people we have responsible for maintaining the cleanliness of our environment, the cleanliness of our air, do what we have elected them to do. So even though it is not an individual responsibility, collectively, we are all responsible also in maintaining the health of our environment, which directly again impacts on our physical health, our brain health, and our mental health. Another thing that we often overlook, especially in this day and age of we're all so terribly busy, we all have 1,000 meetings to attend, we have all these things that we have to achieve. Our poor children, we make them go to school with ridiculous hours. Sleep is an integral part of, or rather, let me put it this way, healthy sleep is a very integral part of maintaining brain health. It impacts on physical health, it impacts on emotional and mental health, and as a result, as well on brain health in general. So when we're small, we need lots and lots of hours of sleep. When we get older, it is true. Some of us say, oh, I can manage on 4 hours. I've been living on 4 hours. We think we're functioning, but it is not good for the brain. And not enough sleep on a chronic basis. So that means on a regular basis, you're not getting enough sleep, also predisposes you to memory loss. So these are things that we need to take care of. Taking care of stress. So there are some stresses that we can't avoid. Right now, I think there is nobody on the planet who is not stressed. But it's not just the stress, it is our ability to manage that stress, handle that stress, know what is worth worrying about, because you can change something, and knowing where to, you know what, I can't do anything about this. I'm not going to let it get to me. Our ability to manage stress depends on our ability to rest and sleep, and vice versa. The more stressed we are, the worse we sleep. So there are so many interlinked things. Again, to recap, our diets, our activity, physical activity, social activity, mental activity, sleep, all of these things play an extraordinarily important role in maintaining our brain health, and as a result of that brain health, our abilities to sustain our memories for as long as is possible. So with that very brief introduction into what memory loss is, I would like to hand over to my fellow speakers, and again, say a huge thank you for this invitation to participate in your commemoration of World Brain Day. It's important that we don't forget. It's been one day, July 22nd, that is the day we commemorate brain health. You have stretched it to a week, and that's excellent, but we should all stress World Brain Day needs to be every single day, every 365 and a quarter days of the year. Everyone, please take care of your brains. It's the most precious thing that we have. Thank you.
Thank you, Dr. Augustina, for that wonderful foundation talk to start the session going. And I request Dr. Riyad Gudair to take us further and give his talk on brain health and cognition. Dr. Riyad. Yeah, you are muted. Please unmute, Riyad.
Just to try to share my screen. I have the PowerPoint presentation there, and just to share it.
Welcome, Kimberly. Kimberly is the project in charge at the World Federation of Neurology. She is.
Do you see my PowerPoint?
No, we are not able to see. Open that and share screen.
I'm trying to do it, but you don't see it again?
No.
Sir, hello. Hello.
Riyad, our IAN digital team can help you.
Hello, sir.
Yes.
Sir, just click on share screen.
Yes, I'm clicking on share screen. I have the screen, which is now the white board and the iPhone, iPad, and I don't see the presentation there. That's
click on basic.
I'm clicking on basic. I'm very sorry.
And first option, the screen.
Follow me.
First option, screen.
Screen, yes, I did it.
And then share.
Yeah. Now we can see.
Okay. And it's okay. I'm very sorry for this technical.
Yeah, wonderful.
And I just want to thank you for the invitation, Dr. Meshram, the Indian Academy, and to participate to this week. My work has been very eased by the presentation of Professor Tina Sharway, and I will speak about things that are, I will say, more of interest of the general population on what's happening on dementia. You look what's happening on dementia, it's something which is increasing rapidly, very rapidly. For example, if you see what's happening in Asia or in Africa. In Africa, the dementia will be multiplied by 345% in 2050, which is huge, and 226% in Asia. So when you see this, when you see all these numbers, it's simply tremendous. And what is expecting us is a very, very massive increase in dementia number. And if you see, you have regions like Southeast Asia, Asia Southern, and Africa also. All these regions are characterized by an increase between 2009 and 2015 of the number of dementia persons. What it is also striking is even the population of the low and middle income countries are young. The increasing prevalence in the next years will be the increase in low and middle income countries. And this is very important. The efforts of the medical staff in our countries is now to try to have what's happening in the developed country, which is relative stabilization of numbers. We cannot afford our health system to have such increase in number and prevalence of dementia. If dementia was an economy, it will be the 18th largest economy in the world. Just to give a figure for people, it will going on from 800 to 1 trillion US and 2 trillion on 2030. So it's numbers that are tremendous and were very difficult to manage by the health systems. Healthy brain and dementia. There was the explanation given by Dr. Tina Sharway. But you have to know that your genetics is important, but things in environment and your lifestyle is also very, very important. These figures from the first description of Alzheimer, what you see here are the plaques that are characteristic of the disease. But you see also how the brain is shrinking, having this progressive cognitive decline. The memory process is encoding, storing the information and the retrieval of this information. And what would happen on the for people who are very busy, well, there will be difficulty for encode information because they are just multitasking people. But in Alzheimer's disease, there will be difficulty in the storage of this information. It's as like our remembering machine is no more working. And if you don't store it, if you want to retrieve it, you will not find it. And this is very important to know. So if you want to have better memory when you are young, please be sure that you encode the information, not having your eyes on the TV, your ear on the phone, and your mind on your study. So if you are there, the encoding will be very, very difficult. One of the ways to have a best memory is to concentrate on the thing that you are doing. Why? That's to show that on MRI, the arrows are showing the atrophy of the hippocampal region, which is responsible of this memory loss. And we have now possibilities to make, even with some imaging, the diagnosis with, for example, the PET scan and the amyloid and tau PET, which show that there is a deficit there. So what to do? We have risk factors. We have non-modifiable risk factor. You can't do anything for your age. If you have inherited ApoE from your family, it's genetic. If you have familial history, this is not modifiable. But there are things that you can modify in your early life, midlife, and late life. We should keep the young have the maximum of education. The less education they have, the more is risky for cognitive disturbance. At midlife, hypertension and obesity. These have to be taken care, and we have not to neglect this. These are silent killers. They kill the body, but they kill also the cognitive function. Consumption of alcohol, brain injury. There are some sports that are leading to brain injury, and one of the example is Muhammad Ali Clay for the box. It's important to know the hearing loss. The earlier you correct your hearing loss, the better you are. Hearing loss is one of the considered as one of the factors that can lead to cognitive impairment. Later in life, avoid smoking, avoid depression. We don't diagnose depression enough in older people. The physical activity is important. The diabetes to be controlled, and the air pollution now we know is a factor. So this is just to show this on the midlife and the later life And this has been one of the work that I'm honored to be one of the authors of the risk reduction of cognitive decline and dementia by WHO. Why preventing? If you see this old work, but still enough because it's projecting until 2074 in the United States. If you delay the beginning of dementia of 5 years, I will say, for example, you will just diminish half the cases of Alzheimer's. This is very important. If we can go on prevention, we can have less cases, less family sufferance and personal sufferance, less impact on our health system. So what we should work on now and the next year is just having more prevention. Drugs are not the only way. You have to work on nutrition, on physical activity, on social engagement and cognitive intervention. Being retired doesn't mean that you will no more use your brain or brain activity. That's a simple mistake. And that's something which is, the people will say, now I will relax. No, please consider the brain as a muscle and continue to train your brain, continue to have activity. That's the best way to keep your mind on a good shape. Physical activity is not making sport once, it's making regular sport. And we know that with good quality of evidence that physical activity is good for normal cognition. We know that tobacco is a bad thing for our cognition, and that alcohol also, it was thought that for once that you can consume regularly alcohol without any problem. If you don't have, it can be taken on small doses. If not, the risk of cognitive decline and dementia is added. Obesity also. Obesity, we have to fight against obesity. I'm from the Mediterranean region, so I will speak about Mediterranean like that. But I know that the Indian food is also excellent and healthy. So but it is speaking as Mediterranean like diet, which is less meat and more fish, and especially more vegetables. One of the things that has been done is this multi-complex vitamins and supplementation. In our report for the WHO, we consider that there is no recommendation that we should give on a strong basis for this supplementation. Please have an equilibrated diet. It will be by far better for you than having all these pills. The cognitive intervention to have a cognitive reserve is important. Hypertension, diabetes, dyslipidemia, we spoke about. One fact is, last one is COVID-19 and cognition. It's not sure that having COVID infection is something that will be safe all the time. What have been shown in several studies that with COVID-19, you have a more severe cognitive decline if you have, even if the COVID is not so intense and with the need of more treatment, I would say, and intensive care. So please make your vaccination to be sure that you will not have a COVID that can alter your cognition, and this has been proven by functional imaging. In conclusion, cognitive function is vital for health, and there is no health without brain health. And the prevention is multifactorial, but should begin very early in life. With this, I thank you again for the invitation, and hope it was useful.
Yeah, thank you. Thank you very much. It was wonderful, Professor Riyad. It's a great talk and great perspective to the whole aspect of cognition and brain health. Now I request Dr. Atanu Vishwas to go over the panel discussion. Dr. Atanu.
Good evening, sir. Good evening, everyone. And this is really a great pleasure for me to be the convener of this panel discussion. And for that reason, I thank the Indian Academy of Neurology, particularly Dr. Mesram and Dr. Nirmal Surya, for giving me this opportunity. So as our previous speaker has already told you, that memory is a very important first function of our health. And it is important for our existence. If we do not have the memory, probably we will not be able to survive in this world. And to keep this memory preserved for a longer time till we die, that is our main goal. Otherwise, if we lose our memory and if we land up in a state called dementia, that would be a very pathetic situation for an individual. So to prevent that happening, it is very important to preserve your memory, to keep your brain healthy. All these things has been highlighted by our previous speaker. I have a very learned group of experts who will participate now in our panel discussions, because memory is not always, loss of memory is not always seen in adults. It is also seen in children and also in young adults. So there are many other aspects which we will discuss. First of all, I welcome Dr. Meena Chandra. There are different types of memory. In our day-to-day life, we know that we can remember the childhood things. An elderly person can remember well, but he or she forgets what is happening in the recent past. So there are present memory, recent memory, and the older memory. So I would like Dr. Meena Chandra to speak about the types of memory so that people can understand. You are muted, ma'am.
Thank you so much, Dr. Atanu Biswas, and also many thanks to Indian Academy of Neurology. It's very important to understand the concept of memory before we talk about memory loss. And sir has rightly said that memory is not a unitary kind of thing, especially during the early stages. When we try to assess, there might be some deficit in some kind of memory, but not in other kinds of memory. So very briefly, memory can be classified as short-term memory and long-term memory. And short-term memory might include working memory or immediate memory. Traditionally, short-term memory is something which pertains to events during the day, 1 week. And long-term memory is anything beyond 1 week or 1 month, depending whether we are doing serial mental status examination. But this is the broad concept. Short-term memory is something which has been coded recently registered, recently coded, and recently retrieved. And then there's working memory, things that we need to store online for a very brief period, like a phone number. So as long as we needed to dial it, we might remember. Usually 6 digits is something that most people are able to do as adults. But now we have 10-digit numbers. So what we do is we make parcels of 5 digits and 5 digits and still try to cope up. But with normal aging also, people might be able to store online numbers for, let's say, only 4-digit forwards and not 6. And that might be a part of normal aging. Another way to classify memory is episodic memory or autobiographical memory, where the memory of events that we have experienced, witnessed. And in autobiographical memories, some information might not be something that we remember directly, but facts which have been conveyed to us, like our date of birth. So that is included in autobiographical memory, but in episodic memory, only events that we have personally witnessed, experienced, or been part of. Then there's something called procedural memory, which is an ability to do a task, like riding a bicycle. So that would be procedural memory. So people might say, I can ride a bicycle, I can drive a car, but I do not remember what I ate yesterday. So he might be having difficulty in recent memory, but not in procedural memory. And then we have the semantic memory, which is the storehouse of all information, concepts, language related, mathematical concept related, everything which we traditionally call knowledge is semantic memory. So that's another way to classify. There are other minor classification, but the general public need not know much. And having memory deficit in one domain does not mean doomsday, that there's going to be memory deficit in a lot of other domains also. But definitely we should be vigilant. In clinical practice, one important memory deficit that we see is nominal aphasia, inability to remember a name, but they may know, they may recognize an object and they may recognize the function of that object, but they'll not be able to tell the name of an object. And that is something very serious that we always see. Though in general public, from patient perspective, it may not be much. I just don't remember names, I just substitute it. But as clinicians, nominal aphasia, inability to remember names is very serious for us. So these are the broad ways in which memory can be classified.
So thank you very much for giving a very brief outline about the types of memory. But now I would request Sujata to talk about, as we all know, the memory loss called amnesia, but is it synonymous with dementia? That means if we lose our memory, all individuals are to be considered as demented, or for dementia, we need something more. So what is the difference between amnesia and the dementia? And what are the other causes of loss of memory apart from dementia? Sujata, please.
Thank you, Dr. Biswas, and thank you, WFN, for giving me this platform today. Yes, memory is a very exciting topic because I think a large part of people generally in the population have this regular complaint that I'm forgetting, I can't remember, I am having some problem, oh God, my memory is failing. So these are the very general ideas, the general complaints that you hear. Now, amnesia, what is that? Amnesia is loss of memory. Yes, it is. And is it dementia? Now, amnesia might be because of different reasons. There might be psychological reasons. If I broadly say that, yes, when a person comes up with the complaint of forgetfulness, when I feel that I am forgetting, I have to first understand that why am I forgetting? Am I stressed? Am I sad? Am I anxious? Am I nervous? So these are the very basic things. So first that has to be clear. Am I in this sort of a stressful situation? Or something has happened inside my brain, which I may or may not know. Like I might have had a stroke, or there might be something which is a milder form of stroke. It might be a TIA, or is there a condition of hypoxia there? Or is there some brain infection? So these reasons have to be examined, evaluated to understand. Did I have, as a previous speaker was speaking, that some high impact sports like boxing and all, they impact the brain also. So has my forgetfulness started after such a sport? Has there been any sort of a viral infection? So these are the very basic questions which I need to understand before jumping to a conclusion that, oh God, I'm forgetting, that means I'm having dementia. No, we have to be very cautious about this diagnostic category. We cannot jump to conclusions. So forgetfulness is a complaint from a child who goes to school till the elderly. So even kids complain of forgetfulness. They complain that I forgot to bring my copy. Adults complain of several types of complaints of forgetfulness, like I forgot my keys, or God, where's my purse? So we are also multitasking today. We are doing various jobs at the same time. We are thinking something and we are doing something. So we are sleeping less. We are racing. So everything has to be understood before coming to a conclusion. We need to sit back and really check our brain health very nicely before coming to any conclusion. So amnesia is a medical term caused due to certain conditions, and it should not be mixed with dementia as such. Dementia is a very slow process, and as our previous speaker said that, and Dr. Augustine also said that now is the time. So we should not wait. We should not wait anymore. If we feel that, yes, I have a bad habit, I have a bad lifestyle, there is something that I can modify, I'm obese, let me please go out and run a bit, I should do that, because that helps anything, and it helps my memory, my brain health. So yes, all type of forgetfulness does not mean dementia. We don't have to be so stressful regarding this word forgetfulness. We might forget names of people also. Fine, that's okay. But we should be careful that even if we forget, the progression of forgetfulness should be slow, and we can do it. All of us can take care of ourselves in that manner. That's it.
Thank you, Sujata. Actually, amnesia can happen even after a head injury. It can also happen after an infection, as Sujata rightly said, that after viral encephalitis. We have recently seen a girl who is just studying her college. She suffered an autoimmune encephalitis just a year back, and she was having a memory problem. But that was a static amnesia sort of thing. It is not similar to that of dementia. It is not hampering her day-to-day activities, but she was forgetting. She was not learning new things in her life. So this can also happen to a young individual as well. Sometimes memory can be disturbed because of infection, because of head injury, because of hypoxia or something others. Not always similar to that of the dementia. Now I would ask Dr. Fahim, who is my very energetic gentleman, a neurologist and expert in the dementia, that forgetting is universal. Every individual above age of 40 years say that he or she is forgetting. Some complaints are benign. They forgets the keys or they have skipped, or forgets the name of the acquaintances. But when a person should be concerned that these memory complaints are not benign, they're serious enough to go to a doctor, to visit to a psychologist or a psychiatrist or a physician or a neurologist to test their memory. Fine, please.
Thank you very much, Dr. Atanu and IAN and WFN for giving me this opportunity. It's a pleasure to be here. Well, it's a conception basically common among the general public that normal aging is a part of dementia, which is not. And everyone experiences slight cognitive changes as shown by Dr. Augustine in the presentation. Then these slight cognitive changes do happen during aging. So in age-related cognitive changes, persons, they have subjective cognitive concerns, they have a slowed thinking, they have difficulty in sustaining attention because obviously they do a lot of multitasking, they have difficulty in finding words. And this is what we call as the benign senescence forgetfulness. And it is used to describe age-related memory decline that is different from memory impairment due to neurological damage or disease. So also findings in normal aging, they are retrieval deficits which respond to cues, and the insight is retained in normal aging, and the activities of daily living are normal. And in fact, the visual, spatial, and cognitive domains are overall there is no significant worsening. Now the question is when to bother, and that is when the person has difficulty in remembering recent events. They would have attended a wedding, they would have met some guests some time back, and they would have completely forgotten them. These are some of the complaints which the patients often come with. In addition, somebody repeating one thing again and again, despite being told what had to be done, and then misplacing things, and then keeping search for them again and again. And you also need to know, does one know the date, month, year? and do they know where they are? And some of the caregivers also say, is there a change in personality? Does the patient have wayfinding difficulty? Do they have difficulty planning, judgment, and decision making? So if any of these symptoms are present, there are three possible. One is maybe an age-related subjective cognitive impairment, which we call the patients, they're worried well. They don't have anything objectively, which would mean that if you do a neuropsychological assessment, you won't find any objective impairment. They only have subjective concerns. So that is one group of people. Then you have a mild cognitive impairment, as said by the previous speakers. In mild cognitive impairment, the one domain is affected, not have any affection of daily activities of living. And then you have, if the affection of daily activities of they are affected daily activities, then we call it dementia. Now, and there is definite objective evidence of a memory loss without ADLs, which is mild cognitive impairment. Now, this is a point not to bother, but to ponder and seek help so that appropriate interventions can be advised at this stage. Because a further progression can be stopped or prevented, or at least slowed at this very stage. Why this is important is because there is evidence to suggest that patients with mild cognitive impairment, they can be reversed back to normal. And if appropriate intervention is not taken at this stage, it will go into dementia. And there is evidence to suggest, initially they used to say 15 to 20%, but now it's around 30 to 40% patients who are in a mild cognitive impairment, they can go into dementia. So MCI is a stage where appropriate interventions can be done, which were already shown by the previous speakers. In the Lancet Commission, you have all the risk factors. If they are taken care of, definitely it's going to be very easy to prevent the progression of mild cognitive impairment to dementia. And so I think MCI, I would say, is a stage at which one should really think and seek help as soon as possible.
Thank you, Dr. Fahim, because it is very important, because once you have a complaint, a subjective memory complaint, many a time we ignore that and we say that it is because of the aging, but that is not always true. One needs to be screened or to be seen by a clinician. It may be the beginning of a process called dementia. So at the stage of mild cognitive impairment, intervention is very effective and you can prevent the development of dementia in the future. So
Atanu, can please request the panelists to be brief in their answers?
Yes, sir.
Yeah.
This is related to the rehabilitation. When somebody loses his memory, so what rehabilitative measures can be taken? Our integrative therapist and the ARDSI secretary, I request Mrs. Vidya Senoy about this.
Yeah, thank you, Dr. Atanu, and thanks to WFNR and IAN for having me at this panel. Very privileged and honored. I would like to, start with an acronym which I like, start a discussion with, that rehab is R for recovering and restoring. E is for empathy, for who is your subject to do therapy for. H is for the holistic approach that I as a therapist would go for. A, an appreciation of the person who needs to be uplifted for whatever therapy they are seeking. B is to make them believe. The therapist is a balm to make them believe that nothing is impossible, because they are going to start building a bond. So as a therapist, I would take a holistic approach. I would cover physical domain through exercise, physical, preferably yoga, because at an elderly, for an elderly population, you have to be very careful of other comorbidities and physical frailty. The intellectual, what they've done in the past, I would take a history, not only of the medical, but the person as an individual, what he spent in his past youth. The emotional and psychological aspect, because we don't know what background they come from, what they've lived through, what are their challenges, and maybe they've had some distress. Their capabilities also are important, because if somebody has been a writer, you can't teach them how to write the alphabet. So we have to see what is their potential that we can utilize. environment component, I think, is very important, that what they live in, which area they are. I think that is a very important point, because if they have lack of sleep, and we all know how difficult it is when there's no sleep available for the person, and it has its own impact negatively on the brain. Socio-economic and spiritual, I think this is very important. For this, taking this as a metrics, I would use yoga, I would use music, arts and craft, painting, just simple things like walk. Read the mind and the heart of the person who's taking the therapy. And basically, a therapist, I think, would see how they can keep them happy, And I think, I believe yoga is the fulcrum of therapy, because you do any aspect of yoga, it's going to open out, your horizon of feeling better. So I think as a therapist, it's important to have a metrics drawn out, goal oriented, and have those parameters that are customized to the individual. Thank you.
Thank you very much for your brief and to the point answer. At this point of time, I would like to say that many parents bring their children with the complaint that they are unable to remember and perform well in their exams. So this is very common complaint, and they often in the market is flooded with memory enhancers. So this is our common experience in our clinical practice. I would request anyone, if you have any comment on that, particularly Dr. Meena Chandra, to speak about this, whether this memory enhancers have any role, and this memory complaint are to be taken seriously for the students.
At the outset, the memory enhancers have no role. They have absolutely no role. They're just marketing. Very sad to say that the medical profession has been hijacked by some unscrupulous elements, including lot of consumer good companies, which are not even pharmacological concerns, pharmaceutical concerns, and they are selling miracle potions and memory enhancers. Coming to children who do not remember, yes, we have the worried well parents of children who are actually fine, who are just disinterested in studies, or who are not able to cope up with one subject or the other. But there is a significant number of children who have intellectual disability, which is not diagnosed, especially the ones who have borderline intelligence and mild mental retardation. The moderate MR and severe MR, anybody can make out. But the sad thing about mild MR and borderline intelligence is that the child is considered to be a disinterested student, or not making enough effort, or naughty, or wasting parents' money, and he or she gets the flag from both the teachers and the parents, and his self-esteem is not supported even by fellow students. So whenever there is any child with memory issues, it is very important to take a detailed history and also see that, do an IQ testing. And sometimes the IQ is normal, but the children have difficulty in either the languages or arithmetic abilities, the class that we call specific learning disability, dyslexia, dyscalculia, the Tare Zameen Par kind of scenario. So it's very important to diagnose early in life mild MR and borderline intelligence, because these are the children who can be rehabilitated and rehabilitated well, instead of pushing them into conventional academics and making them believe that they're good for nothing. These are the children with procedural learning skills. Remember, I talked about different kinds of memory. These children have excellent procedural learning skills. They can be made to excel. But the ones who are actually fine and the parents are only looking for 2% more marks and 5% more marks, I don't think so. The children are ill. I think the parents need a good round of counseling, not to be so ambitious for their children.
Thank you very much. This is very important questions for all the young parents. They are very worried and they want their children to succeed in their life, but all children are not equal. They must know that they have their limitations and they need to be counseled properly. Now, at this point, I request our senior neurologist and Dr. Amitabh Ghosh to speak something about the memory problem, memory loss, and what the message he wants to give to the general public about the preservation of the memory and keeping the brain healthy throughout their life.
Thank you very much, Atanu. Thank you, IAN. I really enjoyed the entire session, starting from the first wonderful speaker right up to the end. And I think almost everything that I thought would be covered has been covered. I'll just touch upon a few points and answer to your suggestion as well. So as we have learned throughout this talk today, memory disorders, it takes a long time. It gives us a long time to fight, if you can use that word, because the damage to the brain, or precisely to the brain networks, because all of the brain is basically networks which are hierarchically kind of increasing with time, from recognizing a simple red ball right up to our complex social interactions, everything we require memory and other cognitive functions. It happens over all the years of our life, but then it also starts declining, starting after 30, but particularly more rapidly if we start developing abnormal proteins called amyloid and tau, which you've heard of in the brain, and we've seen some nice pictures of them as well, of scans. They take a long time to grow inside the brain. It takes 15, 20 years sometimes to grow inside the brain before the first clinical symptom. So the way that your first two speakers have told you how to prevent them, be it with your education, and not, I mean, by education, I don't mean, nobody means rote learning. It should be education. It stimulates your mind. It challenges you. Social interactions again does not mean WhatsApp and Instagram, unfortunately. Social interactions which challenges your brain. That is what is required. So you need to do that. And of course, so many other things. It could be chess, it could be crossword, it could be the diet that has been mentioned to you, exercise, walking, everything. Very importantly, sleep. You have learned that you required sleep. And I'll tell you why you required sleep. It's something which we've learned fairly recently, to be very honest, as far as dementia is concerned. When we sleep, you know, you're told that you need 7 to 8 hours of sleep, right? When we sleep, the brain, inside the brain, it has its own kind of tank of fluid. And when we are sleeping, this fluid, which is in the brain, which actually comes out and through certain channels, goes back in the brain and washes all the toxins that is accumulated in the brain throughout the day. Because of all our mental activities and our stress and everything, loads of toxins are accumulated in the brain. And this fluid comes and it washes itself. So by the time you're waking up in the morning, you're fresh, it takes 7 to 8 hours to do that. So that is why sleep is important. Please make sure sleep early and sleep well. Another thing is, which also kind of can, I wouldn't say replace sleep, but is as good as sleep, is meditation. If you can do meditation, you've learned about yoga. Meditation is another great thing you can do. In fact, we have done some research on meditation as well, and it works beautifully. It's not on. It's slightly unrelated. We've shown that meditation changes positively the gray matter, volume and thickness, even in patients with early AD, not just MCI. So that's something you can kind of try to do, and we are doing more work on that. Stress has been mentioned. Again, I can't just say avoid stress and bingo, you avoid stress. But you need to understand, and that's again sleep and meditation comes. And your social interactions come, how you deal with life comes. Because stress, chronic stress, will slowly eat away on your brain networks. It produces physiological, all the parameters, it changes. It affects the hippocampus, which is the memory center of your brain. So long-term stress is not good for you. So many other things are there. But I think if you can keep these 2 or 3 things in mind, it will really, really be great. Thank you very much. And God bless you all and happy memory.
Thank you. Thank you, Amitabh. And probably we have come to a very end of the panel discussion, because I'm told that by 7:45
you have 5 minutes.
So I would request one thing, that what are the medical advancement that has taken place in treatment of this memory loss or dementia? Dr. Fahim, can you just throw some light about this? Because everybody is eager to know what the treatment, the advancement has taken place in the last few years or so.
Yeah, thank you, sir. Well, to keep the answer very precise, initially we had three medications that were just symptomatic treatment, like acetylcholinesterase inhibitors, donepezil, memantine, and rivastigmine. But now we have drugs which remove amyloid from the brain. So amyloid is a chemical which gets accumulated in the brain. And then we have tau, which is one more chemical that also gets accumulated in the brain. So we have therapies which can remove this amyloid from the brain. So these are anti-amyloid drugs. And recently, last year, one of the drugs called aducanumab was approved by FDA. Although still, there are many other drugs which have lesser side effects compared to this drug. And people are working on it. And I think there's still hope that we'll have drugs which will not only remove amyloid from the brain, but tau as well. Because what's happening, both of them are required to cause cognitive impairment, because tau accumulation is more important for causing cognitive decline. So overall, it's going to be multiple things which are going to help in overall management of dementia, multiple therapies, be it tau and be anti-tau and be it anti-amyloid therapies. In addition to this, there are gene therapies which are coming, but it's going to take a long time unless we have FDA approval for all those. So let's hope for the best. But as of now, I think prevention still it will remain better than cure. So we should do all the factors which were said by all the previous speakers. Thank you.
Thank you, Dr. Fahim. And it was a wonderful session. I thank all my panelists who has spoken in this panel discussion. One thing is very important is everybody has told in this total throughout this discussion is that your brain is a precious thing. Keep your brain healthy. So prevention is very important thing so that you can live a longer life with your preserved memories. So that prevention comes from the very birth of a child, and throughout this throughout our lifetime, we have to practice how to prevent the damage of the brain, how to keep your brain healthy by acquiring education, good education, preventing the damage of the brain through head injury, through infections, and of course your lifestyles like prevention of hypertension, treatment of the hypertension, prevention of obesity, treatment of diabetes in the midlife, and avoiding all those smoking and alcohol, and of course pursuing your hobbies, of course your social interactions. All these things help keep your brain healthy. I hope that will help our audience to understand that to preserve your memory, you need to practice from your childhood till your adulthood. With this, I thank all my panelists and of course our the IAN to give us the opportunity for this wonderful session. Thank you, sir. I hand over this to our President, Dr. Nirmal Surya, sir.
Professor Gisald has joined. So Chandrasekhar Meshram, we can in 2 minutes get ready for the closing remarks and closing ceremony of the World Brain Week. Thank you so much. Let's thank the dementia panel.
Yeah, thank you, Dr. Atanu Vishwas, Dr. Amitabh Ghosh, Dr. Fahim, Sujata, Mrs. Shinoy, Dr. Meena, and most importantly, Dr. Augustina and Dr. Riyad Guder. I think we had a very wonderful session, and we discussed dementia very often. We have done sessions during the World Alzheimer's Day on 21st of September. This year also we'll do, and we'll come to know more about. So as has been said, that dementia is, the treatment is difficult. So best thing is do the prevention. The brain is made of fat, and brain doesn't like glucose as a fuel. So don't, you reduce your glucose in your diet. That is the best thing that you can do in addition to the regular exercises and sleep. Thank you. I have great pleasure in welcoming Professor Wolfgang Risold, the president of World Federation of Neurology. He has kindly joined for this session. He has a meeting at after 15 minutes, and thank you very much, Professor Risold, and it's a warm welcome to you for this last session of the World Brain Week.
Well, thank you, Meshram, thank you, Nirmal, and thank you for this great activity that the Indian Academy of Neurology has done in regard to the World Brain Day. I think your activities, all in all, are overwhelming. And those few sessions which I was able to attend, because there were many sessions, were excellent and of excellent quality. And we all hope that this spirit of brain health that you spread will also catch up in the public and will catch up amongst our colleagues, not only neurologists, but also other colleagues that were mentioned, carers, and of course the public. And as you said, Professor Meshram, prevention is one very important thing. And I think there are many undiscovered and still blocked areas in the mind of persons and in the public that need to be disclosed in order to start prevention. I think I would just mention fast food, salt, sugar, and all those things that we are convinced that make or should be prevented. But on the other hand, we must also think that many people who are of poorer social background only have the choice of eating those things and do not have a choice in order to prevent. And I think the obesity in the United States, for instance, catches most of those people who have no choice in food and have to rely on cheap and on fast food. But I mean, this is just a side thought. Ideally, of course, we have to prevent that. And all in all, I thank you very much. And we are looking very excitedly towards next week, as the WHO will further instruct or suggest how we cooperate on the IGAP. And this IGAP and intersectoral global action plan for epilepsy and other neurologic disorders will be somehow the pathway to improve and to implement brain health. And we will be glad to report and bring the news what should be done to you as soon as possible. But again, you have exceeded all expectations in regard to Brain Day, not only in quality, but also in the number of the activities. And I want to congratulate the Indian Academy of Neurology. Thank you very much.
Thank you, Professor Risold. I would like to welcome Secretary General of Indian Academy of Neurology, Dr. Meenakshi Sundaram. Meenakshi.
Chandrasekhar, if you allow me, I can present a small PPT if they can share the. So before Professor Risold leave, he have an idea what has happened in last 1 week. Digital team, can you share the PPT?
Can I share my PPT also?
Yeah, after this. This is a full week report. So
Yes,
after that. I must thank Professor Grisol, whom we caught today morning, thinking that he must come. And it was very nice of him that he could spare 10 minutes for us. Very, very thankful to him. Just move to the next slide, please. So this is just a brief report we have done, the national activities. Next, please. 2 million step challenge, which is detail will be given by the Dr. Surya Narayan at later half. And we started with Dimag Pe Charcha with Curtain Raiser, where Professor Grisol, Professor Hamdan, and Tisha were interviewed by me as an interviewer, more like a TV show, and that was wonderfully well conducted. I was very impressed by their answers. 22nd July, the first Brain Health for All was a session inaugurated by Professor Wolfgang. And these are the various data where the people have attended at Zoom, Facebook, and YouTube. Next. And 23rd was substance abuse and brain health. Again, you can see the attendees at various platforms. Next. On 24th was loss of vision and vertigo. And the attendees were further. And 25th was loss of consciousness. Marco Medina was also there. And 26th was neuromuscular weakness. Again, attendees were consistent in all the three social media platforms. 27 July, we had backache, neck pain, bladder bowel, and sexual dysfunction, which was conducted by Neuro Rehab Subsection, Dr. Mandiratan and Abhishek Srivastav. And these are the attendees. Next. Neuro Rehab Subsection did 3 webinars, 23rd, 25th, and 27th on neuroplasticity. This was on the rewiring the brain and brain health. Next. This was on cognition and brain health, tips to keep it running, and brain trigger update in neuromodulation. Social media activities has been far and wide, and you could see that we had 114 neurologists giving messages on Twitter, Facebook, and there were 6 activities in all, and there were 360 total posts and messages on all social media platforms. And you could see that viewership at Instagram rose to 14,022%. At Facebook was 530%, and Twitter was 1,912%. So we nearly had 11,500 viewers. Next. The Twitter impressions are here, profile visits, mentions, and tweet impressions. So the wide reach, and these are the Facebook page reach, which is could be seen between gender, women, and men. So we are reaching out to a lot of people. Same is for Instagram. Regional activities has been many, and many of my colleagues will share. Dr. Meenakshi Sundaram, Meshram, Dr. Gagandeep Singh, Sumit Singh from Delhi, Vivek Lal from PGI, Subhash Kaul from Hyderabad, Sunil Narayan from Pondicherry, Debashish Chaudhary from Delhi, Suvarna Alati from Bangalore, Niemens Joy Desai from Mumbai, Shefali Gulati from AIMS Delhi, Bindu from Nellore, Asta Thakkar from PGI, Sikandar Advani from Amravati, Manish Mahajan from Delhi, Manish Modi from Ludhiana, and Netravati from Bangalore, and Professor Alim from Trichy. So these are the people who, and many more, Sumaya Nayak from Kathak, many more have done the programs, Subhash Kaul from Hyderabad, with Abhinay Ucheche. Next. Bhavna Sharma from Delhi. And then there was 22 doctors gave their radio messages on FM. So this is all has been done, and we will come back with a complete program booklet, and we will present you during the IANCon 2022 at New Delhi. Thank you once again for the support, and we are committed to reach out to each and every member of this country. Thank you. Meshram, if Dr. Wolfgang want to say something before leaving, or he already left?
I can only say very impressive. Thank you very much. And nice to see these figures and worked it out. Beautiful.
We had
Thank
planned
you.
for 100 activities. We did more than that.
Yes, I can see. Now it's impressive how you analyzed that so quickly, and it's very impressive. Thank you.
Thank you.
This is my thank to team of digital team that they have worked, not me.
Perfect.
Yeah, Mesham, the Dr. Meenakshi Sundaram can present his.
Yeah, Dr. Meenakshi.
Can I just quickly what we have done? It has been it has been a very interesting week because I don't think we have ever done. This is more like a family function, some wedding going on at home, and we have all been very involved the whole week. Thanks to President Dr. Meshram and the whole Indian Academy of Neurology. This is what we've done. 22nd, we kicked off the Brain Week celebration and awareness on brain health. We had talk. We actually started off by cutting a cake. So what better way to celebrate the brain than celebrating the brain's birthday on that day? So we started off with that. Then we had an awareness talk. I gave the talk on brain health on that day. So the 23rd, we had an awareness talk on stroke by my colleague who is a stroke interventionist. That was on the second day. So that was me again on the second day. We had that on 24th was a Sunday, an awareness talk on Parkinson's disease and brain health. And this was done in my own center here. And 25th, we had a neurosurgeon talking on head injury and brain, and had a very attentive audience through the whole week. 26th, we had an awareness talk on epilepsy. My colleague, Dr. Vivek Iyer, did this part. 27th, that was yesterday, we had an awareness talk on headache by Dr. Ravi Kumar, a neurologist in our center. And you could see that patients were taking videos and photographs of the talk. And that was me again yesterday. We had a wonderful poster and quiz competition for all the paramedics, the nurses, pharmacists, everyone in physiotherapists. In all, there were 57 posters. And the quiz, we had 65 participants. And this is them at work. And we had some very, very good posters in a very short time. We gave them a week's time and about 57 posters came up. The theme was brain health for all. So you can actually see that there were very many ideas. We were amazed by the creativity. And today we had a talk on brain tumors, and prizes were distributed. There was a brain week quiz which I had conducted, as I said, and there were 65 participants, and the first 3 were awarded. So there were awards given on this day at our place. And that's my colleague, the director of neurosurgery. And I had the opportunity to give a talk on brain health for all. So in all, 10 awareness programs were conducted by one center. So you can actually see how much would have gone on throughout India. It has been wonderful this whole week. Thank you very much. Thank you.
Amazing work. Amazing work, Secretary. Lead from the front.
Yeah. In Nagpur, we did 14 activities in addition to the national. So 7 talks on All India Radio, 37 publications so far in the newspapers, and the more will follow.
Wonderful.
We had 4 talks in the schools, 7 talks on All India Radio on headache, Parkinson's disease, stroke, head injury, brain health for all, and other topics. And then we had Walk for Your Brain Walkathon on Sunday. And I had given 2 interviews on brain health for all on the television channels. So the total of 14 activities we did in a span of 7 days. Thank you.
Mishram, between you and me, we have done 25% of the target of 100.
Yes.
So digital team, kindly check if there are people from music group, because we have been able to make a song for the neurologist. So if they are there, they can, Ujjwal and Manish Mahajan, they can join, because Ujjwal wanted to sing that song, which we have specially made for all the neurologists of the country and of the world, that how the neurologists are taking care of the health. So Ujjwal, if you are there, just check digital team. If he is in the attendee, kindly move him into the mainstream.
I'd like to thank Professor Griswold for being with us on a very short notice. He had another meeting, so he's leaving. Thank you, Professor Griswold.
But really, congratulations for all the work that has been done. It's really impressive.
Thank you, Riyad.
And we look forward to see you in November.
Yes, I have already captured the topic and will send it to you.
Thank you.
It's about genetics.
Thank you so much. Has anybody joined our digital team?
Yeah, Ujjwal is there, and
yeah,
you can see
Ujjwal is there. Please get him inside.
Dr. Nirmal, Dr. Sharmakar, may I leave? I have another meeting with
Yes,
Wolfgang.
please.
Yeah, thank you very much. Thank you, Riyad.
Thank you.
Thank you so much. See you soon.
Yeah,
yes,
thank
sir.
Bye-bye.
Bye-bye.
Bye-bye, everyone.
That is not Dr. Ujjwal Roy. That is
Okay.
probably someone else.
No, he's not our Ujjwal Roy.
No, sir, it is written Ujjwala.
But you had mentioned only 8 o'clock, so maybe people are.
Yeah.
I think people are probably.
Yeah, we have to change 15 minutes before for Professor Griswold.
Understand. But they won't know, no? They'll join here after.
It's a amazing work for 1 week Dr. Meshram has been doing. I think he must have stopped all his work and just working on getting the people, coordinating press notes, as if, he is the, editor of the newspaper. He has been sending the news everywhere. Amazing, amazing.
Thank you.
I must say that everybody has risen to the occasion and did a wonderful work. I've never seen.
I think all over the country, it was like a festival.
Yes.
the
And everybody wanted to do better than others. So that was something.
So much of an excitement and we are very thankful for the international faculty joining.
Oh, yes.
Yes. And every day we had the international faculty. On first day, we had the 5 people, Professor Griswold, Stu Lewis, then we had Tisa, David Dokik, and then next day we had WHO, Dr. Katrina. And
you join now? Why not? Please join. Yeah, Surya Narayan.
Yeah, good evening, sir.
Yeah, Surya Narayan, yes. Go on.
Good evening, sir.
Good
Yes,
evening.
sir.
Good evening. Yeah.
Yeah. At the outset, I thank World Federation of Neurology and IAN for, hosting this 1 week brain event. Actually, what we did is a week-long different events in Bangalore. So we did 3 public awareness events, 2 in colleges for college students. One is for a Toyota engine industry in Bangalore for the workers and employees of Toyota Bangalore division industry. And next one was we did a painting competition for school children. We did a painting competition for school children. Around 50 children participated, and we gave prizes to 3 best kids, and all kids received participation certificates and high tea. And next is about the runners group. As I told last time, we did a 2 million steps challenge. We believe in fitness on a day-to-day basis, and we requested all our members to do at least 10,000 steps per day. Around more than 60 members have participated, and we got around I'm sure we have crossed 2 million, but I don't know the exact numbers because people are even now they are submitting the data. By tomorrow afternoon we will get back on the exact numbers. And also I have written a newspaper article on the brain day and the importance of brain health awareness. It has reached more than 9 million subscribers in Canada. And also there are 2 digital platforms where we have written, and that also has reached more than 5 1 million subscribers. So this is what we have done for the World Brain Day event, sir. I thank Dr. Nirmal Surya and Meshram sir for giving this opportunity.
So the 10,000, they are the 2 million steps. The deadline is tonight. So people are still,
yes, sir.
People are still working. So we still
Yes,
not.
sir. Yes.
Yeah, thank you.
Mine is at 9,800. So
yes, sir.
200 I have to go. By the time I reach home, I'll be there. Thanks.
Thank you, Dr. Suryanarayan.
Sure, sir. Thank you, sir.
Dr. B.K. Madhusudan, he has done quite a few programs. So is he there, or his report you have?
Yes, sir. Dr. B.K. Madhusudan, he has done one a talk in a university in one of the East Bangalore. It's a university campus he has done with the help of the Vice Chancellor of the university. And second, he has done a Facebook Live program on brain health awareness that he did it 2 days back. I think Nirmal sir was one of the guests for that talk actually. So he has done 2. Dr. Amit Kulkarni, he has done 1. He has done a public awareness talk in a college, that is Global Academy of Technology in Bangalore. I think NIMHANS people also have done some activity. I think they should be able to update on that.
Perfect.
Yes. Thank you, sir.
Manish, have Ujjwal joined? By the time Ujjwal joined, we have Abhishek Srivastava, who had done quite a bit of work.
Ujjwal has joined. He is in the
Thank you, sir. From the new rehab subsection, we have done about 5 programs. Can I share some slides, sir?
Mansi?
Yes, sir, you can share.
Yeah. So these are the activities done by the subsection in last 1 week. We first did a program with the IFNR, with the subsection on 22nd, to the multidisciplinary panel discussion. Professor Vijayaratne joined that day, on the first day with that. Then we did a discussion on neuroplasticity, rewiring the brain, with 3 talks from Professor Surya, Professor Yadav, and myself. And then next day we did a program on cognition and brain health. Dr. Khurana speaking on how to keep brain young, Shantla Hegde on music and brain, and Uroshi on cognitive rehab. Fourth program was brain triggers, a bit on neuromodulation. Professor Lakshmi on BCI, me on robotics, Professor Nayan on neuromodulation. And the last program was yesterday as part of the WFN-IAN program on the topic on backache, neckache, bladder bowel sexual dysfunction, with Professor Ellen Nagate from Queen Square, Professor Mandirata, Professor Sankla, Navita, and Dr. Nayak from Orissa. So we did 5 programs in this 1 week, and I thank Professor Surya, Professor Meshram, giving us the opportunity to do this wonderful activity in the World Brain Week. Thank you.
Thank you so much, Abhishek.
Asta is joined. Asta can
Asta, you present the report.
Yes, sir. Sir, I'll share my screen, sir.
Yeah, sure.
So is my screen visible to everyone?
Yes.
So this was a 5-day event which was organized as told earlier. So we had these 5 activities, and we did it under the heading of helping optimize, palliate, and educate. This is the heading where we are doing all our public awareness and our social awareness programs. So the first program was No Stain on Brain, and like we know about stigmas of various brain diseases. So we had this printed booklet, small booklet, and OPD. These TV screens were placed whereby patients were made aware continuously about various stigmas which are our brain and how they can be improved on. So this is our second activity, Train the Brain, in which around 9 public schools of Chandigarh participated, and prizes were awarded to various students. Around 30 prizes were awarded, and 3 medals in addition were awarded. I've just tried to portray a few of the best ones, which I felt should be portrayed over here as well. So this is our third activity, which was done at the nursing college. And as you can notice, sir, we had a slogan writing competition on Train the Brain. Sir, though I have put these slides in, we have many slides or these programs as well. But again, three top students received cash prizes. 3 top nursing students, they received cash prizes for Games for Brain. So this is our fourth activity, which was Food for Thought and Brain, whereby general public, specifically the people at primary healthcare and civil dispensaries, were made aware of the importance of good and clean food, specifically with regards to brain diseases. Again, so we gave small prizes to the people who participated to encourage them for their good participation. And this was our last program which we did for sleep health and brain. So don't drain your brain. And again, we had small games on how to improve your sleep, and specific talks related to sleep activities and brain health were given. So these were the 5 activities which took place in PGI.
Fantastic. Very well done. Thank you. So Manish and Ujjwal, if you could present your song.
A very good evening to everyone. First of all, thanks to Nirmal Surya sir and Mishram sir for being the guiding light and this great support they have provided. And I think a platform which is a universal and a national platform actually to connect and to disseminate, and what we all actually are developing an extra attribute to connect together and show solidarity on a national front to support the cause of not as just as a doctor, but as a human being, as a different level of connect with our patients as well. So we have with us Dr. Ujjwal Roy from Ranchi. He is an astute physician, neurophysician, but he is a great musician as well. He's a composer, he's a singer, and he has composed one of our and the process is ongoing because we the Neurogama group, which includes all the senior, the middle level and the young generation neurologists across India as the members, we are trying to come up with a group song which would be highlighting the importance of brain health and this role we as neurologists play in the health of the people of India. So Dr. Ujjwal is here. He will give you a glimpse of that song. Dr. Ujjwal, over to you, please. Ujjwal, you are mute. Yeah.
Yeah. So
maybe if you can
you hear me?
Maybe if you can. Yeah, but I think your signal is low. So if you can just move to a better signal area.
1 minute, just let me try. Because actually I thought that I would wind up, but I mean,
no worries. Please, you can go ahead. We are able to hear you.
Could not wind up actually on time. Yeah. So so this first of all, I want to thank Dr. Nirmal Surya sir, whose vision has always helped me both personally, professionally. This idea also came some a song, and when Dr. Nirmal Surya and Dr. Manish Mahajan both were very much that that there should be some awareness song also. So we week and World Brain Day not been able to complete it till now, but I think maybe by another yes we will be. So so that song actually that song goes like this. Can you hear me? Hello.
Yes.
Better, Ujjwal. Yeah.
So so the lyrics is like, हम हौसला बन जाते हैं, आशा की किरण जगाते हैं, ब्रेन के रखवाले हम हर न्यूरॉन्स को बचाते हैं. So this is the whole thing. So I'll just sing for you. I'm sorry, I'm in a basically mini casualty, but there is no patient actually. So I will sing, no issues. So it's something like that. हम हौसला बन जाते हैं, आशा की किरण जगाते हैं, हम हौसला बन जाते हैं, आशा की किरण जगाते हैं, ब्रेन के रखवाले हम न्यूरॉन्स को बचाते हैं. And then again, and then every paragraph actually, it has got some or the other theme. Suppose the first paragraph we have put for a stroke and paraparesis and these kind of. So it's like jab ang ang bejan ho. I'll sing just one paragraph and just give you the glimpse that what is it all about. So jab ang ang bejan hua, jo धावक था विकलांग हुआ, जब मस्तक से शरीर का सारा संपर्क छूट गया, पहियों पर पड़ती जिंदगी को हम कदमों पर दौड़ाते हैं, न्यूरॉन्स के रखवाले हम, ब्रेन के रखवाले हम, न्यूरॉन्स को बचाते हैं. So this is the song. It is already we are planning for the whole song like in other languages also, and we will have a mixture of all the languages, like straight from Kanyakumari to Kashmir. We will have one line of every language, something like Mile Sur Mera Tumhara, so that we can play it in national platform also, as well as all the states will have its own versions. Like suppose we are going to West Bengal, so there West Bengal of IAN, like neurology, whatever you say, or Neurogama, we can say, because Neurogama had taken the initiative. So we can say that Neurogama has song for every state, like every language regarding the brain and brain awareness. So this is the whole idea is all about. I'm sorry I could not, I mean, I thought that I'll reach to the studio and let you meet me with my other people who are working in it, but I'm very sorry I could not reach to that place before that. Actually, I had a stroke patient, so I mean I had to stay back.
Well done, Muzwal. Well done. And English version also is coming. Punjabi is also coming. The Tamil also is coming. So everybody is converted. Them Gujarati Sudisha has already converted. So everybody is really get motivated to have the regional languages. Thank you very much. And you sing very well. So wonderful.
No, sir. Not about singing. It's about your motivation. You always motivate people to do something. You, मैंने जिसको बोलते हैं कि हिंदी में बोलते हैं कि बिल्कुल डंडा लगा के काम कराना, तो you know that how to do it basically. So you have been always doing that, but it has helped a lot, sir. Really.
Thank you. Thank
you. Yes.
Shefali, you want to say your thing, what you have done?
Yes, sir. Good evening, everyone. We had done two things. One, we had done a World Brain Day event with the Doordarshan, and that we had an adult neurologist, Dr. Debashish Chaudhary, head of GV Pump, and myself from the pediatric neurology. So we covered the whole lifespan and all the issues, and that was in the national network, and it's available in YouTube also. And then yesterday we had done one public health lecture in which we had done the theme we had kept for brain health issues in school going children, the concerns and solutions. And we had divided that into 3 panels, in which first panel we talked about the typically developing children and what issues they face in the school. You know, like you have ADHD, you may have autism, you can pick SLD, etc., etc. Then second panel was on special needs children in school. Third panel was what are the demons, you know, the screen time has been hyped up and all the mental health issues which are there on these children. And then we also had one of my colleagues from Gosh who spoke on traumatic brain injuries, because that is a very common preventable cause of issues. And then I had spoken on the role of technology in helping these children in the normal education as well as for special needs both. So, and we had also launched, we have actually developed one web-based application for based on artificial intelligence. We have made a remedial education program for dyslexia children with the research over last couple of years, and which we have shown in fMRI that it improves language networks, and it has shown that it later on the fMRI becomes similar to the controls which were typically developing. That we launched yesterday, and that will now be available for people. So all this has been this little things we have done in the occasion of brain health.
Fantastic. I think Devashish has sent a video also for his activity. Unfortunately, he has some other meetings, so could not join. But his activity, he's sent the YouTube video, so we will have it on our record. Sumaya, you are there. can you also tell you have done 2 activities on 22nd and 27th?
Hello, sir. So, good evening. And I first of all like to personally thank you and the entire team, actually, Abhishek sir, for not only giving us the impetus, but also guiding us step by step on this Brain Week. So, we went forward and we did a wonderful program. I'm very sorry I could not prepare slides, but I have sent already the report to your mail ID and also IAN, and I have also WhatsApped you. So we actually did 2 programs on one on 22nd and the other on 27th. 22nd, we went to one of the best schools in Barampur, and we did a program, a essay writing competition, and also we did a drawing competition. The drawing competition was from for classes 5 to 8. More than 100 students they came out to participate, and essay was for the elder children 9 to 12. Around 100 to 200 kids participated, and we actually had a very hard time to decide on who are the winners. So what we did was them class wise we gave prize. So those teachers who have done a wonderful work in the school, so we also felicitated them. On 27th, we had an awareness program in the same school for class 5 to 12, and that was attended by more than 600 students, and also all the teachers, some parents, and a lot of media people also attended. And what we did was we invited the SP Barampur as the chief guest. So he was so enthusiastic and he took part and he was so interested. He actually, when we explained him the concept, so he said, "It's very wonderful. You call me every year, I will participate." So the dean also was very happy. He said, "There's a brain day. We did not know he's an orthopedician." So he said, "I'll also participate every year." So we had a wonderful interaction, and the students were actually very lively participating, and the teachers also came. We asked them to spread the news to various other forums. Media people were there, so we had videos and news coverage from the media also. So overall it was a very successful program, and personally I would like to thank you. And to culminate it, we had yesterday evening we had one program. I had to rush down from Barampur all the way back 200 kilometers, and I reached in time to join the evening program, the international faculty program. And it's all hats off to you, your motivation and your guidance. So sorry I could not make 2-3 slides, but I've sent all the reports to IAN secretary and your mail.
I must say that you are the only one whose report has come much before in time. So your report is already there. So thank you very much. And I hope all of you who has done the activities, report comes, because I'm going to compile this and wish to present 100 activities which we promised. Of course, we have done more than that, to Professor Grisol during the IANCon. Indian Academy of Neurology, EC Meenakshi will remember, has always been thinking how to motivate the young student to get involved into the neurology and get motivated for the neurology. And I think you guys has been doing exceedingly well. The Sikandar Advani's art exhibition and the painting competition has also been some fantastic photograph. Dr. Meenakshi Sundaram has shown them. You have also shown. I personally feel that I'm doing an appeal to you guys that 2 of your best painting, I think these students, please invite them during the IANCon Delhi. We would like to have these 10 or 12 students. Sumit has done it in Delhi. So all of them to have it on Sunday morning, because we are having this public forum program. There we can have their paintings being kept into the exhibition, and then they can talk about what they have done, and we would give them a memento and a certificate to appreciate their effort. So that much I really wish to do. And I hope that you will motivate this top uh, students who have done the theme-based painting to come to Delhi during the IANCon. Meenakshi, you have any thought on that? We've
Yeah.
always been talking about, promoting the students, undergraduate, postgraduate, and this may be a good beginning to start with,
Yeah.
and then they can get more and more people involved in the schools.
Not just even medical students, no?
Yeah.
This was so it's a painting thing. This now involves many other things. See, the first prize winner in the quiz, I was amazed by her creativity. She is a technologist in the histopathology lab. Now, to read about the brain, to get out so many things, to find about it, and make a poster that with so much information, I'll post it. The second prize winner again was a nurse, and the third prize winner was a physician assistant. So now thinking about how these people were motivated, how they came, 57 posters is no joke. We don't even get that in state conferences of urology. Sometimes they fall short. 57 posters presented by them, put up on display, the whole hospital was amazed. So the involvement was wonderful. So I think it will be good encouragement to bring them along. The top three can come. The only thing is, since it's in Delhi, they will have these travel issues and all that. So we may have to work on that. We can request for a free registration. We can request for stay. That is manageable. The travel part would be something that we may have to find a way. So if we can do that, I think what
So
you say,
local organizer can look into that.
look into that. We can request them. Otherwise, we can.
Yeah.
Find. That's a great idea.
So Jaslovin, you have done any activities? You have raised your hand.
Yes, sir. So, as Dr. Ujjwal already has explained about the activity that we are doing regarding the song, we've also prepared a poem on dementia. It's a Hindi poem to explain about dementia, what dementia is, and what we can do about it. It's just to bring awareness on World Brain Day. That's all.
So all these things can go on to the website into the public part. So, I'm looking out that all these write-ups and the various things should be available to the society free of cost. So we are going to make a patient page where all this should be available to them. Dr. Meshram, over to you now. I think everybody else. Is there anybody else left over?
Pramod is there.
Yeah.
Pramod Donde.
Alim has joined. So Alim
joined. Pramod.
Yeah. Pramod and then Alim.
Should I share my screen, sir?
Yeah.
Yes, you can.
So this is just a small activity done. We have done just now, finished now. And this is a brain quiz and painting competition we have kept for 5 to 15 years age. And there was this very great enthusiasm from the students. And this was the competition we have kept. And actually almost 50 students have participated from the school. And there was a great enthusiasm about knowing about the brain and all these things are there. And we have kept anatomy specimen also from Department of Anatomy, Government Medical College, Nanded, so that they can see actually the brain, how it works and what it looks like. And we have involved the teachers from the local school where they have chosen the winners from the participation from quiz as well as from the painting. And we have given prizes, 3 prizes for each for the competition from the students. We have given the clay also to make brain and for 5 to 7 years of kids, so that now they are knowing most of the parts of the brain and how the stroke happens, what is stroke, what is MRI, everything put up into the questions. So basic knowledge about the brain we have tried to give in, and try to tell them that the mobile hazards of mobile use and headache and everything, so that they are probably get more aware of knowing the bad effects of mobile use and migraine and everything. And we are told about the stroke thing, basically more about reaching up to hospital within 4.5 hours, role of thrombolysis, what is RTPA, all this has been told to the parents as well as the teachers, so So they were also knowing about these things now. And these were the kids in the competition. All of them have hugely enjoyed this competition. So that hope we are going to keep this now. Whatever the paintings they have made, we are going to keep the one of the exhibition for the paintings for the parents, and we'll see in the next part what enthusiasm the parents will show now. Thank you once again.
Very well done, Pramod. Wonderful.
Thank you, sir.
Alim, please.
Thank you, sir. Sir, India is the only country which have conducted more than 100 and above programs to mark the 9th World Brain Day Awareness Activity of 2022, sir. All credits goes to our IAN, its president, Professor Nirmal Surya, sir, and our secretary, Professor UMS, sir, and the dynamic person, Professor Chandrasekhar Mesram, sir, who chaired the IAN to conduct awareness activity on neurology all over India, sir. I am from Trichy, is very much thankful to you. Allow me to conduct an Brain Day awareness program on 22nd for special children about their brain health in collaboration with the Central Library of Trichy. And also we have published an article in the Indian Express to mark the World Brain Day, sir. Thank you very much for allowing to join IAN to conduct this program, sir. Particularly, I am very much thankful to Professor Nirmal Surya, sir. Thank you, sir.
Thank you, Professor Alim. Credit go to all of you because it is done by you people. You have taken it. You have taken my word very seriously. So I am actually thankful to all of you because you have taken it forward and you have done it. It's not me, I have done it. You have done it. You all have done it.
Thank you, sir.
Meshram, over to you. The time is over now.
Yeah, I think, thank you. I don't see any new person joining. So I think we had a very great World Brain Week awareness program. All these sessions are available on YouTube. Those who have missed can listen to those YouTubes. The programs will be available on Indian Academy of Neurology website. They will also go to the World Federation of Neurology website, and so that the people all over the world can see that what activities we have done in India. I would like to thank all those IAN members who have done exceedingly well, and they come forward with innovative ideas. There are different approaches, different doing different things. We can, some years back, I had done for 3 years continuously painting competition for school children, and then published a book of all those paintings, and they presented that time to World WFN President Professor Raj Shakir, and the book was released. So similar thing we can do now. We have a lot of good paintings, good materials, so it's a great collection. And I think what we had planned we could do because of the dynamic leadership of our president, Dr. Nirmal Surya. He's a great motivator, and great support from IAN Digital team, and Dr. Meenakshi Sundaram, Secretary General, and the whole of IAN executive committee and IAN members. I think the WFN, that the whole world is impressed by the activities that we have been doing, because the international faculty had come almost every day, and they witnessed what kind of thing that we are doing. And I think it will go a long way, and the people should take inspiration from India and the Indian Academy of Neurology, that how we should go about running the public education awareness campaign. we have been doing throughout the year. India is the only country in the world. I would tell you that we do activities throughout the world, and because of that, these activities get published in the World Neurology newsletter. This newsletter also we had the publication from India about this activity. So once again, thank you very much, and in future also we expect great support and involvement from all of you. Thank you very much.
I only request to all of you
Thank you,
is
sir.
kindly subscribe to our channel, forward it, re-forward it, so that messages goes to the everybody. We are still not reaching out. IAN channel should be, Facebook should be reaching out to at least 1 lakh people. We are not yet. We are just 5,000. So all of you have a responsibility to spread the message so that maximum number of people can get benefit of our true knowledge and can be guided rather than misguided by others. So please, humble request.
Everyone is requested to please send a written report, maybe 100 words, not more than. We don't want a very detailed report.
1-page report with photograph.
Yeah. So you send it. So we'll compile the whole report and get it published in World Neurology, make a booklet, as Dr. Nirmal Surya said, present to the World Federation of Neurology, president during IAN-Con. But before that, I want that within a week, you should send the report, what activities you have done, so that, I can send an article for World Neurology and to the team of World Federation of Neurology. Thank you.
Thank you.
Thank you, everybody. See you again.
Thank you, sir.
Thank you,
Thank
Mansi and IAN digital team. Thank
Good
you.
night.
Thank you, sir.
Mansi,
Thank you.
Bhavesh and Asta, thank you very much.
Asmita.
Asmita.
Thank you. Thank you so much, sir.
Thank you.
Thank you very much.